DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to the show. Dr. Dan here. Thanks for joining me. We're going to talk about doing necropsies and the value of doing a necropsy in your herd when you have an animal that dies. My guest, Dr. Mike Apley. So stay tuned for a great show.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Folks, welcome to the show. Welcome to the show, Dr. Apley.
Thanks.
Folks, this is Dr. Mike Apley, and he's a friend and colleague here at the College of Veterinary Medicine at Kansas State University, where he serves as the Frick Professor of Production Medicine, Clinical Pharmacology, all things cows, all things food animal, and does a whale of a job not only representing the beef industry on a local level, but nationally and internationally. And today we're going to get down to something that we've done quite a few of.
You've done more than me. I've had better success, I think.
Obviously, the person who's had the most deads underneath their purview is the one that has the most necropsy experience. So we will yield to Dr. Apley today on all the discussions about doing necropsies. But anyway, all kidding aside, it's something pretty important for telling the story or getting a diagnosis.
It's really important, and especially as you get further and further away from the routine. So if we talk about there's routine surveillance, and then there's, something's really, really different. We need to look at this. So routine surveillance, sometimes we can get into patterns where animals are treated for a certain thing, have a typical clinical appearance, and maybe the intensity isn't quite as required there. But when we get into things that are really out of the ordinary, and especially as you get out into cow herds and stocker operations, you see something, man, that just wasn't right. What's going on?
Yeah, well, and there's a couple of different things, the sudden unexpected death, or the one or two or three.
Yeah, the pattern.
The pattern of unexpected deaths, and really, people know their herds. People understand their cattle, and to get my dad used to say it was easier for him to sell a vaccine for a few $1,000s than to sell a diagnosis for a few dollars.
Yeah.
And that's where we're at right now, is we're going to talk about getting that proper diagnosis. And so, you mentioned cow herds. And why is the cow herd different than the cattle feeding facility?
Well, in a cattle feeding facility, 75% of our morbidity is respiratory disease, and about 50% of our death loss. We have a lot wider variety in death loss in an adult cow or a bull. And one of the things that's really caused me to want to do this segment is times where, as a veterinarian, I've come into a situation, or talked with veterinarians who've come into a situation where, wow, we're 10 animals in, or we're way into the outbreak, and we're just starting to think about a necropsy, and early's good.
Right, because one thing about a necropsy, while we may get the gross lesions, and we're going to talk about this in the next segment about what your veterinarian is going to do, there is some time frame beyond the necropsy until we get the answer back of what's really going on.
And sometimes it'd be 3 to 5 days, and depending on when in the week and everything, and the type of test you're running. So the clock starts ticking pretty early.
Yeah. So let's take a break. When we come back, we're going to talk more with Dr. Apley about necropsies. And specifically, we're going to talk about getting that diagnosis or what your veterinarian's going to do or look for when they come out on your farm. You're watching DocTalk. Dr. Mike, Dr. Dan, more after these messages.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Darcy Messerly has no specific memory of when she decided to pursue veterinary medicine as a career goal. All she knows is that she's always wanted to be one, a desire fostered by her association with animals and livestock production as a child. Blessed with a group of mentors who helped guide her, Darcy plans to join a mixed animal rural practice after graduation.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Parasites will lose you more money than any other disease out there besides infertility. So, parasites is something that we have to control, and that's what VetGun does for us. It's tough out there on a ranch, but with the ease of the VetGun, it's a one-man operation, and whenever you can get one thing to work out great throughout that day, it just makes my life a little easier.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Mike Apley, and we work at Kansas State University's College of Veterinary Medicine, and we're talking about a necropsy with beef cattle, Mike, and how soon do you need to call someone?
As soon as they get that look in their eye would be nice. Obviously, in the summer, we're on a pretty tight schedule. An adult bovine can start to decompose really fast. And so the ability to tell what's going on and see some of the gross lesions is dependent on us getting a pretty good chance. So, the minute they're found and the question is raised, we need to figure out more about this. We need to know.
If you don't, you go out and do the necropsy, you send the samples in, you get the autolyzed tissue results, and we've all gotten those. And what happens then is cost of the necropsy, cost of mailing things in, cost of checking them in, and no results. So the sooner you get somebody there, the better. And obviously winter and fall and spring, not as much as a hurry as summer, but in the summer, get somebody out there quick.
Yeah, and the thing, even in a 50-degree or 40-degree day, even in the shade, the heat generated by the rumen in those animals and everything can make them go downhill pretty fast. We're not able to tell much.
So my veterinarian's coming out to do a necropsy. What's going to happen?
Well, they're going to need a place to do it where there can be obviously some things moved around, and we're going to want to be able to lay them on the correct side and have room to move them around and lay them out. And we need to know whether you're going to be rendering the animal or if you have a place to bury or compost the animal, depending on local regulations and what you're set up to do. So if we know all that at the start, that helps things up, speeds things up.
So we're going to come out, we're going to put the animal in a position to do the necropsy, it'll be left side down.
Yes.
Put the rumen on the ground, and then what is the veterinarian going to do?
Well, I'll tell you how we teach it here at K-State.
Okay.
The way you and I do it is we start at the tip of the jaw, and we work clear back to under the tail with one big incision, and we start laying things back. And one of the reasons we like to do that, if they are rendered, we protect the hide so that there's some value in the hide left. Obviously not as important if to be buried or composted. And then we'll start into the abdominal cavity and work through the thoracic, the chest cavity, and up through the neck, and we start looking at things from the tongue clear as far back as you can go. And you'll find most veterinarians have developed a very systematic approach to going through the different organs and looking, and that's one of the values of veterinarians doing a lot of these is if you see a lot of normal, you can recognize abnormal.
Right. So there'll be a system in place. We're going to take a look. And when we do the necropsy, that's really just to get a look at the gross lesions.
Mm-hmm. Yeah, and then samples will be collected to where we think we need to, and sometimes samples may be sent in the absence of gross lesions because we know or we're suspecting something that's going on that maybe in that particular tissue might not have yet had time to show a lesion.
Cool. Well, let's take a break. When we come back, we'll talk about what kind of happens when the samples leave the farm, go into the diagnostic lab, and start to get a diagnosis for them. You're watching DocTalk. Be sure to work with your local veterinarian, Dr. Mike Apley, Dr. Dan Thomson. More after these messages.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
I'm Dr. Kip Lukasevich with Production Animal Consultation. Today's BQA Tip of the Day is proper SOPs. At the feed yards today, it is important that we keep a list of SOPs. SOPs stand for Standard Operating Procedures. Those operating procedures can entail anything from abortion procedures, castration procedures, and dehorning. The biggest one is the cattle care and handling guidelines. I think it's really important to have those SOPs on hand, just so that when people come and they audit your yard or do an assessment, we at least can show that we've had proper training and we have proper material for those yards. The other thing that we keep in our SOPs is our processing and treatment procedures. And so one of the biggest things here is making sure that we have the drugs that we're using, as well as when we do our treatment procedures, that it's listed out in order as far as what the symptom is, the diagnosis is, as well as what the treatment regimen would be. So that is our tip of the day.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. Beef producers asked for it, and the wait is over. Enroflox 100 Enrofloxacin from Norbrook, now approved for single-dose treatment and control of bovine respiratory disease, with the same active ingredient and dosing regimen as Baytril 100 in beef and non-lactating dairy cattle. Choose Enroflox 100 when looking for an injectable antimicrobial solution to treat and control BRD. Observe label directions and withdrawal times. See product labeling for full product information, including warnings and precautions. Consult your veterinarian to see if Enroflox 100 is right for your cattle.
TrueTest Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Mike Apley, and we're from Kansas State University and the College of Veterinary Medicine. We're talking about necropsies. We're talking about, getting a vet on the farm, why we're going to do a necropsy, which animals we're going to do a necropsy, how soon, what we're going to do. Now let's talk about some of the common diseases.
Well, there's some things you could get a really quick indication of what's going on. For example, anaplasmosis in a lot of parts of Kansas and parts east and south especially, but a lot of parts of the country. People are familiar with the challenge of that disease when vector season starts midsummer and on through to 30 days past the killing frost, and I hear people having them in the dead of winter too. But a veterinarian will be able to pretty quickly pick up that that's what's going on through the icteric appearance of the carcass. It'll be yellow and looking at characteristics of the spleen, etc. And probably would still be laboratory confirmation, but that would be enough to go, we need to start some control and really watch the other animals right away. Other diseases, respiratory disease, of course. In a cattle feeding situation, we're going to take a pH of the rumen. The rumen would be very, very fluid filled because the water gets pulled in there. And so take a pH and work forward from there. Bloats, intestinal obstructions, intestinal diseases, bovine viral diarrhea, infectious bovine tracheitis, BVD, IBR, characteristic lesions.
Yeah, and when we start to go through, you and I both work from the front to the back. We're going to be looking for the lesions of BVD on the tongue and the esophagus and the ulcers. You look for IBR in the trachea. And then the one that we're going to see too is bovine respiratory disease in the lungs.
Yep. And we can get an idea, not really precise this many hours, but we can get an idea if it's been pretty chronic or a pretty fresh case and those types of things. We can tell if there was a reproductive issue. One of the other things we do more and more is look in joints and feet and legs and see what's going on there. So there's a lot of things that you can get an initial start on before the diagnostics of an immediate reaction to.
Absolutely, and there are some diseases like the anaplasmosis, the mycoplasmas, things to that nature that if we get a diagnosis grossly, we can initiate treatment sooner, because we're going to have to, this is something that spreads through the herd, and getting treatment to the herd or therapy or control is vitally important of making sure we don't lose other animals.
Yeah, and another area that requires a little more work to get to and isn't done on each necropsy, but is the brain. The brain, there's some gross lesions, but a lot of times that involves sending it in for histology, and then again we're into our 3 to 5 days. By the time it gets there, things are done in the infospac.
Yeah, so the first thing is, folks, get a vet on your place, have them do a necropsy, especially the things when you know your herd and something just quite isn't right or something that's different. The older cow that doesn't have any teeth, that's probably not the one that you're going to worry too much about the necropsy on. But you get those 3-4-year-old heifers or 3 to 4-year-old cows, and you have a death. Then we're going to get on top of this and really having a part of a biosecurity plague in your herd.
Well, one of the diseases that's classically only causes clinical disease in 3 to 5% of the affected ones is bovine leukosis virus. And my little herd, we found out that it's a lot higher than that when it first came in, and the first thing you saw was a cow with congestive heart failure, and you go, what's going on? And she had it in her heart. Yep. And it's good to know, and so the way we responded to that was new needle each animal and stuff like that.
Good. Folks, necropsies are important, something that can be a great tool to your animal health. More after these messages.
That's My Breed, brought to you by Premium Sourced Cattle. Learn more at toolcattle.com. The Sim Angus breed was created in the late 20th century in response for a demand for a crossbred animal combining the superior qualities of the Simmental with Angus or Red Angus. Very popular as a means of producing cattle with high performance and high market acceptance levels. The Sim Angus breed combines the best traits of both parent breeds. Bulls are bred to calve easy and increase quality in pounds without sacrificing cow herd efficiency. Females exhibit excellent fertility and milking ability and produce calves that have excellent carcass quality, high meat yield, and meat quality. The added hybrid vigor produces healthy calves that grow faster and replacement females with increased longevity to produce many calves during their lifespan. A registered Sim Angus animal comprises between 1/8 to 7/8 Simmental and 1/8 to 7/8 Angus or Red Angus. Breeders choose the percentage breed mix to suit their own herds and the markets they supply. Nestled in the sand hills of Colorado, Premium Sourced Cattle has built a business based on supplying proven, hard-working Sim Angus genetics that add value to their customers' bottom line. Committed to using all the available technologies available, they are offering up bulls that will cover more cows and maintain their flesh and soundness better than most yearlings in the country. Join them on Wednesday, March 23rd for the 4th annual Bull and Female Sale. See total offering at www.toolcattle.com.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with my friend and colleague, Dr. Mike Apley, who's boarded in clinical pharmacology. He's a veterinarian who works with beef cattle and different food animal production systems locally, nationally, internationally. One of the most respected veterinarians in the country, and I'm lucky to have him as a friend and get him here and come be on the show. As you see us out and about, we always get tickled when somebody comes up and say, hey, I saw you on DocTalk or whatever. So be sure to come flag us down and talk to us. Give us some ideas about shows you'd like to see. But as we're talking about necropsies, Mike, you know, we've gone through the gamut, and now there's going to be another discussion after the necropsy.
Yeah, because now we've done the gross necropsy.
Right.
And now the decision is, are we going to do something more? So there's a cost for doing the necropsy. Are tests warranted? And so the big question I've always discussed is, will spending the money on those tests change our plan? Is there something different we might do knowing whether it's actually this organism or this specific disease? And sometimes there definitely is. And you know, we start to think, man, I've just lost an animal that's worth, you know, this was a bred replacement heifer and I'm in the mid $2,000 worth of value. And I'm going to spend more money after. But the thought isn't about the one that's laying there, it's about the other 30 or 40 or 50 that are out there in the field.
Yeah. I mean, it's when you sit out there and you look at 30 animals that are worth $75,000 or $150,000 standing out there in the pasture, and we have one that dies, it seems pretty, it seems as though we're stepping over dollars to pick up dimes when we don't get a proper diagnosis or necropsy when something could be percolating. You know, it's kind of like the iceberg theory, right? Mm-hmm. When you see the tip of the iceberg, that's one thing, but everything underneath.
You know, and we've just talked about adult animals, but another very, very important facet is aborted fetuses and placentas.
Yep.
You know, if you can get the placenta and the fetus, that's very, very valuable to have that pair to go in, because, you know, it's obvious there if you've got 100 yet to calve what's going on. And the other thing to understand is sometimes the value of the necropsies aren't that we can immediately shut down what's going on now. It may be rolling too far, but it's about biosecurity. It's about planning for next year, how we bring animals onto the place. Do we need to test and call? Those types of decisions come about from these tests. And our tests have really gotten better these last decades to where we have a lot more confidence in our conclusions.
Great. Well, thanks for being on the show today. And thank you for watching DocTalk. Remember, always work with your local veterinarian. And if you want to know more about what we do at DocTalk, you can find us on the web at www.doctalktv.com. You've been watching DocTalk today. I appreciate you joining us. I'm Dr. Dan Thomson, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.